So today we're going to take some time to discuss a very interesting topic, which is basically more about preventive aesthetic dermatology. And I've taken this opportunity to connect with my patients and also people who are interested in understanding what all can be done for us to get the best skin. And definitely, things have changed, and it's not like it's just about what you apply, but a lot about how you treat yourself. Because when we were doing medicine, the actual definition of health is not only physical, but it's also emotional and social health. So there are a lot of aspects of health which come together. And I know that most of you must be aware that our skin is the largest organ of our body. And a lot of the diseases that we suffer from actually reflect on our skin. So, similarly, if we wish to have the best skin, we also need to ensure that we take care of ourselves holistically. So, I think we have got some people watching the live. I'm going to take as many questions as I can. And in case we run out of time or we can't answer all the questions, you can just DM me and we will be getting back to you with your answers to the best of my ability. So let's start today's discussion. So we're going to talk about preventive aesthetic dermatology, or the science of healthy living. Everybody around wants the best skin. And what do we define as the best skin? So the best skin reflects your inner health, and we require smooth, blemish-free, radiating, translucent, resilient skin. So it's a huge definition. And how do we attain that? So there's certain things that we can do to attain this. Of course, if you people have been on my page and you've been seeing, we talk a lot about the pyramid of skincare. So you need to definitely have a good skincare regime which has a broader base, which talks about what you need to do on a daily basis. And then as you come toward the apex, then there are some things you do on a weekly basis. And then there are some things you do once a month, preferably in a clinic. So that's how that goes. That we need to continue. The next is we need to prevent the negativity that comes into our life. In terms of skin, of course, what we're specifically talking about is stay minimally as possible away from pollution. Smoking isn't that good for your skin. We talk a lot about sunscreen, so UV protection is another important preventive aspect of good skin. The next thing is how you feel and how you take care of your body. So exercise is absolutely essential. So half an hour of exercise, I would suggest, if all of you can do that, would be great, because that is what is going to ensure that you have more of the happy hormones or the endorphins, and that will also help and that will reflect in your skin. Right. The next thing we're going to discuss now is the most important is nutrition. So I've been receiving a lot of questions. We've been doing a lot of telephonic conversations and a lot of WhatsApp messages, and that's what actually motivated me to do this session is, doctor, should we supplement? How much should we take? What should we take? Is it a good idea? So, nutrition, like I would say, Hippocrates has always said, let food be your medicine. And I totally believe in that, because how we look is a lot about what we're eating, and how our body is feeling reflects on the way we look. We're going to discuss a lot more about how we can build our immunity and how we can get the best skin by what we eat, right? So, to start with, we need to discuss the most important aspect. So, I got a question talking about water. So, how much water should you drink? Everybody will say, all doctors, all the skin doctors will say, drink a lot of water to get the best skin. But how much is that exact amount? So it's very simple. What you can do is you take your body weight in kilograms and divide it by the figure of 23, and that will give you the exact number of liters of water that you need to drink. For example, if you're roughly around 65 kilograms and you divide by 23, it'll come roughly around 3 liters of water. So to further make it simplified, it's difficult to carry a bottle around. So you can, whatever mug or whatever glass that you are carrying, this would be around 300 ml, or a normal tumbler of water is 300 ml. So that simplifies it further. and you need to ensure that in the day you are consuming that much water. So that's the first thing to do. I've got a lot of other questions regarding the use of antioxidants, and because we are all facing a lot of stress in terms of emotional stress, physical stress. A lot of us are sitting at home, we're not doing our usual daily routine, there is a lot happening. So there is a concept of antioxidants. Now, whatever I discuss, I'm not endorsing any particular brand or any particular drug. I'm telling you whatever is scientifically there. And I'm talking about supplementation. Please understand, I would please advise all of you, don't go and just pick up anything and start popping it in, because it's not going to help you. Whenever you do decide to take some supplementation, it has to be prescribed by your doctor, because it's the dose that is extremely important. And the second thing is the brand that you use. Please don't buy OTC drugs, because we really don't know what's the content. So one prescription will really help you. So if I now go back to antioxidants, what is this wonderful thing that everybody talks about? Take antioxidants. So our body is undergoing oxidative stress, and antioxidants are going to reduce that oxidative stress, which is at a cellular level. So when we are getting exposed to pollution, when we are getting exposed to too much of UV rays, when we are in emotional stress, our cells are undergoing a lot of oxidative stress because of the circulation of free radicals in our body. And these antioxidants actually help to get rid of the free radicals in our body. If you remember the biochemistry, if any of you are science students, there is something known as oxidation and then something known as reduction. So the oxidation that is happening, we need something to counter it, and the antioxidants are going to help with the reduction of those products. So that is how it works. Now, which antioxidant and what's the best to use? So there was a study which was recently published which spoke about glutathione. Now, what is glutathione and how is it to be used? How does it help our body? So glutathione, a lot of people have the misconception or myth that is for skin whitening. Please understand that's just a byproduct of what the medicine does. And the byproduct is so good that everybody only thinks about that. Just put that aside. What I want you to understand is glutathione is actually a protein which is made of 3 amino acids. And what that does is, like we just spoke about the oxidation and reduction, the glutathione is actually going to reduce your oxidative stress. In turn, it will reflect on your immunity. So it's going to help build your immunity. It's also going to, of course, help you get better skin. So which glutathione to use, how much to use, when to use? Please don't do all these things on yourself. Okay, so glutathione is available in what we eat. So you can use cauliflower, broccoli, avocados are very good in this natural substance. However, the study reveals that as we are getting older, our stores are going depleting, and we do need to enhance it. And it also spoke about that people who had deficiency of glutathione manifested the more severe form of the COVID-19. So those people had more severe respiratory disease. Therefore, it's a good idea to think about supplementing and fighting it, because if your stores are good and everything is well, the chances of you getting a more complicated situation are less. Please understand, this is not therapeutic. This is actually for prevention. So whatever supplementation is done is for prevention, and it needs to be done for a particular amount of time, particular dose, and how to use it is important. So now coming back to glutathione, it can be taken orally. There are some sprays available, so sublingually, and it can also be taken intravenously. So glutathione is used extensively in the practice of medicine for our chemotherapy patients who are taking, medicine for cancer. This glutathione helps them to build their immunity and also helps them to counter the side effects of your chemotherapy medicine. So that is how strong an antioxidant glutathione is. So the next very important antioxidant which I want to speak about is vitamin C. Everybody says, oh, how much vitamin C? Should I take vitamin C? How is it going to help me? How is it going to help my skin? So yes, vitamin C is excellent. Animals can make their own vitamin C. Unfortunately, human beings don't have that ability. What we eat also helps us to build that vitamin C. Again, I'll go back to scientific data. So there are studies. There was a meta-analysis done, which is compiling all the studies done by various doctors, and it was seen that people who are on vitamin C supplementation as a prevention have lower chances of getting viral infections. So it's not curative, but again preventive. So whatever we're talking about is prevention, because prevention is better than cure. So vitamin C definitely is going to help fight viral infections. It helps to build your collagen. It also helps in UV, like the exposure that you have to sun. And there are studies which show that vitamin C actually counters the effect of UV radiation. People who are on vitamin C do have better protection against sun. So therefore, vitamin C is a good option. Now we come to how much, where, when to eat. Please visit your doctor. A physician should guide you how to use this. Substances that have vitamin C adequately are citrus fruits, spinach, bell peppers. Please understand the quality of our food is not as good as it used to be. We're under stressful situations, therefore, supplementation will help. How long and how much is important. The recommended daily allowance of vitamin C in an adult is about 92 milligrams. Okay, so that is how much you need to take every day, since you're not I've got a question is, how do we take care of our scalp and hair with growing age? We will come back to that also. So scalp and hair also is a lot of reflection of your health. So often you think, oh, I'm losing hair, something is wrong. A lot of the times it's your nutrition which is causing that, right? So coming back to vitamin C, I would recommend that please ensure that you're getting a proper prescription. The amount of supplementation can be anywhere between 200 milligrams to 1 gram a day. That depends on what your need is. That depends on what the situation is. It's usually recommended to take on a longer period of time, and understand it's not going to cause any harm. It's going to get the excess gets excreted in your urine. Okay, so those are the two main antioxidants which I wanted to discuss. The fruits which we spoke about, one thing that is very prominently containing vitamin C is pomegranate. So you may consider adding that to your daily diet. Ensure that you're eating healthy, eating good, because you're not exercising that well, so the chances of piling on more weight are more common in this sort of situation. So that's about antioxidants. Now let's move on to the next category. Okay, I just got another question which says, I eat a balanced diet, so do I need supplements? That's again very often. A lot of people say that I have a balanced diet, doctor. I take this. So do I still need to consider supplementation? Please understand that, like I said, we do eat good food. The quality of food is not as good as it used to be. There is much more pollution. We are undergoing a lot more of stress these days. And so pulse dose of supplementation helps. So understand, there's a myth that if I eat well, I don't need supplements. That's not really true. You need to understand that it's the amount, when and how much. So please get a recommendation, just one visit to your physician, or anybody, even to me. I would like to help you and make you understand, okay, this is what you need, this is how much you need, and this is how you need to eat it. Okay, so that is, I hope that answers your question. So a balanced diet is very good, but it's still not going to give you the adequate nutrition, especially in certain stressful situations. Also, it depends on what sort of symptoms you're having or anything else that you're associating with the problem. So these are the two antioxidants we're talking about. And like I said, they're actually going to reduce your oxidative stress. Now the dose depends. Again, I got another question, says, can vitamin C be given to children? It can be given to children, but the dosage will be much lower. And you can actually supplement the children with high vitamin C in their diet. The best way to take dietary vitamin C would be to divide it into doses. So don't take everything in one go. You can actually divide it into multiple doses and take it throughout the day. So for example, if you take lime in the morning, you can take a sweet lime in the afternoon. You can take guava, or you can take bell pepper. Chicken does not contain vitamin C. Again, I got a question. It is basically in fresh fruits and vegetables, leafy vegetables, and it is very quickly denatured. So it's raw fruits that we recommend, and that is what's going to give you the dose of vitamin C that you need. Right. Now let's come to things that you can do at home. So we don't want you always to jump to a clinic and get your treatments done. So what can you do at home? Um, Many of us are doing our little bits. Some ingredients which you can take at home, which are going to help build your immunity, at the same time they're going to help with your skin health, is turmeric. Turmeric scientifically is known as curcumin. Curcumin has several uses. It also helps in tanning as well as building your immunity. It's got very good anti-inflammatory properties. So when we grow older or when we are in stress, our body is undergoing inflammation, and we need things that can calm that inflammation so that we are stronger at a cellular level. So somebody has written, should vitamin C be taken after meals strictly or anytime during the day? Vitamin C supplements are better taken on an empty stomach or just before your meal. That's the best way to tolerate it because it gets absorbed better. Okay, and also vitamin C is better in an effervescent form since that is going to absorb better. Okay, right. Yeah, so we're talking about what all you can use at home to build your immunity. So curcumin or turmeric. Turmeric is going to help you reduce your inflammation. It can be given to children, especially in the raw form, which you can grate and you can put in water. Other things which can really help you are spices like cinnamon. You can use ginger because these things have got, again, very high antioxidant and anti-inflammatory properties, which is going to help to build your immunity, and it's going to help your skin fight the cellular stress. Other spices like rosemary and all are great. Ginger is good for your gut health also. It's going to keep your gut in order. Sometimes it's a good idea to put everything, soak it overnight, and you can boil it, and then you can add lime in the morning and take it. It's very good. So you need to keep your gut healthy, you need to keep your antioxidants high, you need to keep the inflammation levels low, and all these ingredients that we're talking about can help you to do that, right? Flax seeds are very good. So another product which we want people to take are omega. A lot of people diet a lot, they don't take any fats and all in their body, but trust me, your skin needs some amount of fat to give that shine, and it's important for your generation of hormones and vitamins. Some vitamins are fat soluble. You need your essential fatty acids, so please do take more of little bit of omega-3s. Flax seeds are a good source of omega-3, so you can add that in the concoction that you decide to take in the morning, right? So that's about home care. Now, another important aspect of your diet which can really help is more and more of raw fruits, right? So raw fruits are going to give you your supply of your vitamin A as well as your vitamin C and E. So if you talk about skin and hair health, somebody asked me a question about hair health. If you have any hair issues, I would really suggest that it's important that you show your doctor and go through a series of blood tests. Your hair is a reflection of your health again. So your hair, nails, and skin put together are formed of proteins, and the commonest cause of hair fall is nutritional anemia. People don't know that their iron levels are down, and or their calcium or vitamin D are down, and they're just applying some oils. That's not going to help. Oral is going to help you more, but please get yourself checked, and then based on what the need is, we're going to put you on the needed vitamins. So micronutrients in an Indian diet are very low. Again, there was a study about what Indians eat. Most of us are vegetarians, and a lot of us eat dal rice or dal and roti. Basically, most of our food is cooked, and it is depleting a lot of the minerals in our body, and that's another cause of hair issues. So what is the micronutrients that we want you to ensure that you're taking enough of? Are zinc, selenium, vitamin A, vitamin D. Most of you, I'm sure, have had some blood tests, and vitamin D in the Indians is very low. I've hardly ever seen a normal vitamin D report. And I used to think, big deal. It is a big deal. The moment you start taking that vitamin D back, you will see you have better bone health. So all the women, please take the calcium and vitamin D because it's going to help your bone health. You will see you have less of aches and pains. So micronutrients actually are going to help with your internal health. Suggested is eat more of raws. Again, zinc and vitamin B, like biotin, is one of the aspects of your vitamin B, which is excellent for your hair. So ensure that you're getting enough of that. And if you have any symptoms, you need to please get yourself checked by a doctor. So I've got another question. What kind of good fats can we take during weight loss? That's a very, very superb question. um, like I said, there are some fats which are okay. They're not going to really get you in trouble, and your body does need them. So the omega D3, like flax seeds, are an excellent source of good fats. Fish is an excellent source of good fats. Avocado is an excellent source of good fats. So you can take this in your diet and it will help to give you better skin. Right. The next thing which I want to really discuss is two of my favorite products. Um, I have seen a lot of people getting results. So, what are they? Collagen and hyaluronic acid. So, should you use collagen? What is collagen? What is hyaluronic acid? Our skin is basically formed of two major uh, aspects. Collagen, almost 60 to 70% of our skin is made of collagen. And what is it? It's a protein. It's a protein that helps us, our skin, to be resilient, to be shiny. And as we get older, we are not able to synthesize that much collagen. And how do you know that? So you will feel your skin is duller, it's drier, you may see more lines and wrinkles on your face. So collagen is very important. Especially, like, again, a lot of us are vegetarians, so vegetarians are finding it difficult to keep up with the requirement of protein. A lot of my gym enthusiastic patients take whey protein. Please stay away from it if you have acne, because whey protein actually is not so good for your gut and it can stimulate more of acne. Collagen is a good option. So there are many types of collagen available. There is collagen 1, 2, and 3. We're looking at 1 and 3 for our skin, hair, and nail health. How do you take it? You can get supplements available. You can ingest them. Ingesting them does give very good results. Somebody has asked, how do you know? So I have some case studies. There are patients who I have put on this wonderful product called collagen. And what do they see? So the first thing, somebody just spoke about hair health, hair fall, brittle nails, and they also, after taking the collagen, which we are recommending 500 hydrolyzed 5,000 hydrolyzed milligrams a day, or 5 grams a day is what is the recommended dose. If it's taken over 4 to 6 weeks, you do see evident results in the quality of your skin. And so around 4 of my patients, which I kept as case studies, they're like my friends. And the feedback that you get, that they get from people who they are meeting, is that your skin looks much better. How do they feel? They feel less amount of dryness in the winter. They do feel that there is a little bit of shine in their skin, and their nails are breaking less. So that is the advantage of supplementation. And please understand, it's not that you have to wait till you're 40. Excuse me, you start aging much, much earlier than you feel. So we start aging as early as our mid 20s. Okay, so I'm sorry to break the bubble. A lot of you must be thinking, oh, there's a lot of time, I'm still very young. Unfortunately, we start aging much, much before we really think. So if you are getting any of these symptoms and you think you want better skin, it's not bad. I'm for supplementation as long as it's done properly, the adequate doses and the right product. Please don't buy over-the-counter collagen, over-the-counter. We don't know what it is, okay? So please don't do that. And in India, another challenge I face is a lot of my patients are vegetarian. So we will tell you what are the good vegetarian sources that you can use, how much to be used, when to be used. So collagen is good. The next one which I want to discuss is hyaluronic acid, or HA. Our skin is full of that. Our eyes are full of that. Our bone spaces are full of that. And that is what gives the hydration to your skin. And you cannot apply HA serums and expect to get any results. So either you drink hyaluronic acid supplements, or you get it injected on your skin, and it will give you the best glow that you need. Okay, I'm now getting towards the end of my discussion because I don't want to keep you people waiting. I just have a little bit more to talk about is acne. What should my acne patients eat? So Mediterranean foods are great for acne. So you can take figs, plums, as well as olives. They're excellent for acne prone skin. Lastly, I'm going to talk about weight loss. Everybody is like, oh my God, how do I lose the weight? I have so much weight. What do I do? Trust me, it's the struggle we all face. It's a process. Enjoy it. Go slow. When we get older, our metabolism slows down. Some food to boost that is you can take, it was there on my last Tuesday tip, but just quickly, you can take apple cider vinegar, chilies, celery, and squash. So all these four actually boost your metabolism up to 8%. So twice a week you can use any of these, and that will really help you. Yeah. Yeah. So somebody asked, what do I do in terms of treatments? There are some things which we are all struggling with. Pockets of fat, which we can help you in terms of treatment. Another thing which I find absolutely excellent is we don't have time to go to the gym, and as we age, our body composition changes. So what do we do to build our muscle? We are so lucky we have devices these days. Like we have a device called Hypersculpt, which can actually give you those crunches which you can't do on your own as fast. You don't have that much time. So when you get older, you need to build your muscle mass, and then that's how the fat comes down. So you're changing the composition of your body. So that is a very, very good option. Lymphatic drainage is also very good for weight loss and for giving you the shiniest skin, because lymph is what has all the toxins. As we get old, our lymphatics are sluggish, so we can improve lymphatic drainage. So we have options to do that in the clinic, and then of course there are some people who get regular massages that can also help, but that is not as regulated. And the last thing is, you can try intermittent fasting because that really works. So a 12-hour window is to be absolutely followed. So if you can fast for 12 hours, it's excellent. Sunrise to sunset is what is recommended. It's age old. It's there in all the Ayurvedas that we talk about. And that will also get you back to your usual weight slowly and steadily. But friends, it's a process. So keep going and it will happen. Now I think I have just 1 minute and I have some more questions. Please suggest in a day what all supplements can I take, okay, and what dosage. So I'll answer you directly. I'll DM you that answer because I'll need to ask some questions about you. Like I said, you need to individualize patients. I can't just give you a broad prescription that everybody eats the same thing. My final note, please do not pick up OT products. Don't go overboard and eat all the supplements. At the same time, it is important that you use some supplementation in pulses. This is the time we need to do it because we are going through stressful situations. I am totally pro that, and I think it has really worked for my patients and for myself also, because I believe in practicing what I preach. So I do some supplementations, and it does really help with building your immunity, getting your energy level high, and it reflects on your skin and hair. So with that, thank you guys, and if I am not able to answer any of your questions, please DM me. I